So the agenda that we have for today is as I said, it's quite heavy. So we will start with a bit of introduction of the team. Then we will move on to do a bit of recap on what IRIS is, because I'm not sure if you're all familiar with it. Then we will have a session on registration and access management to the system. We will move on to the planned go lives for the various inspection types that we are onboarding in IRIS. We will talk a bit about the GMP business process. Then we will do the same, but focusing on the GCP business process. You will see that there aren't many differences, but there are some specificities that we want to highlight to you. Then we will present to you the notifications, and I think this point would be very important because it's about how EMA will communicate with all of you, with your companies, which are applicants or MAHs for centrally authorized products. So keep an eye on this one because I think you will all find it important. Then we will talk a bit about the next steps so that you know what's coming after this training session. And then we will show you a video that displays how the industry portal works in practice, because the industry portal is the actual interface that you will use to communicate with EMA. And we will, of course, tell you how you can use it, and this includes both GMP and GCP inspections. And then, as I said, we will have a bit of time to cover questions and answers. So please feel free to write your questions in the chat as they come up, and we will collect them and, as I said, answer at the end of the presentation. So I already introduced myself, but as you can imagine, I'm not alone. This is a project that really characterizes for, like any other project, by strong teamwork. And this wouldn't be possible if it wasn't for the people that you have on the screen right now. So you can see at the top, my colleague Dunia, she's with me in the room today, and she's our subject matter expert for pharmacovigilance inspections. We also have Miguel, who is our expert on GCP inspections, and you will have the chance to hear his voice because he will touch on the points related to GCP. We also have another colleague, Baptiste, who is focused on GMP inspections. And last but not least, we have Carlo de Vittoria, who will explain more about the access management. He's an information security officer at EMA. And also our business analyst, Delia, who has kindly put together the videos that we will be showing you and who has been supporting us in an amazing way. So this is the team today. And what I'm going to do now is I'm going to tell you a bit of what IRIS is about. So first of all, maybe a bit of background as to why we're doing this. And I'm sure this is not something that is new to you. I'm sure in your organizations, you've been experiencing this digital business transformation. And I guess the drivers for such transformation are not so different. In our case, as you know, EMA supports, coordinates, and operates a significant number of regulatory procedures, and this goes across the life cycle of the medicinal product, from pre-submission to post-authorization through evaluation for both human and veterinary medicines. And the procedure management systems that support these activities actually have grown tremendously over a number of decades, in part because of the pieces of legislation that have come into application over the past 25 years. So there is a need for EMA to invest in its core processes upgrade, because some of the systems and technology that are supporting these regulatory procedures are now over a decade old, and as you can imagine, they result in very high maintenance costs. So the aim is that by improving our internal corporate IT tools, we will be able to continue to support the EU Medicines Regulatory Network and its stakeholders. And in this case, we have you as key stakeholders, industry, in an efficient and sustainable manner. So in summary, we need to evolve digitally to be able to respond to all the environmental influences brought by not only legislative initiatives, but also technology innovation, global trends, and increasing stakeholders' needs and expectations. So what is IRIS? So IRIS is essentially an information management platform. And some of you, or perhaps some of your colleagues in your companies, are already familiar with it because IRIS is up and running for a number of procedures that we manage at EMA. For example, parallel distribution or orphan designation, scientific advice, innovation task force, and more recently, marketing status. So it's a secure online platform for the handling of product-related scientific and regulatory procedures within EMA. What you have at the bottom of the screen is the link to the IRIS portal, which of course this is the public homepage. So once you have the relevant credentials, once you are IRIS users, you will be able to access through this link. So what are the objectives of this new platform? Well, on the one hand, one objective is to offer a more secure and digital way of sharing information. And on the other hand is to be more efficient and offer a collaborative way of working. So we are trying to move away from UdraLink. As you know, at the moment we are using UdraLink to communicate with companies quite heavily. So we are trying to move away from this. We are trying to automate our processes, avoid having to rekey information, offer a platform where inspectors can collaborate together, and also connect with the master data management system at the agency. You might have heard of SPOR, which stands for Substances, Products, Organizations, and Referentials. So let's talk maybe a bit more about the technology and the components of IRIS. So we can summarize IRIS into, let's say, 3 sides plus a document repository. So I'm going to start with the last one, the document repository. The one that we are using is actually SharePoint. And as you know, SharePoint is a cloud-based file storage. And this is accessed by the EU regulatory network, of course, and by EMA staff. And you as company users, you will also be able to access certain areas of SharePoint. The idea is that this will offer a secure platform for document sharing and viewing. In addition to the repository, we have what we call CRM, which is the Customer Relationship Management System, which is the interface that EMA staff uses. So when we receive an application and we need to validate, process that application, we will do so through CRM. In addition, we have 2 portals. We have, on the one hand, the network portal, which is the interface that is used by EU regulatory network, so meaning the NCAs. And we have the industry portal, which is the interface that you will be using as industry stakeholders. And this is the interface that you use to provide data and documents, and this will replace the use of UdraLink at the moment that we have for the provision of such information. And going a bit deeper into the actual technicalities of the technology, as I said, IRIS is cloud-based, and you can see that we are using Microsoft Azure for the managing the access. So we have a platform that is the EMA Identity and Access Management platform that is based on this technology. Then we use Microsoft Dynamics, and this is the technology supporting the industry portal, the network portal, the CRM portal, and also the public registers. You can see that some of the pillars under these portals are actually related to what I mentioned earlier, to SPOR. So the Master Data Management System of the agency, which is split into 4 pillars: OMS, that looks after organizations; RMS, that looks after referentials; SMS, that looks after substances; and PMS, that looks after product management. We also have a connection with SAP Finance, of course, and with other EMA systems and database. And the third component is Office 365, and this is supporting SharePoint, so the document repository, as well as Microsoft Teams. So a bit of recap, and even though here at the top it says key benefits for network users. Actually, we could say that these are the key benefits for stakeholder users in general. We believe that this provides efficiency because we will have in a single portal all inspection procedures and documents related, and it's a user-friendly interface. We think that it will save time for you, for the inspectors, and for ourselves, because you will have immediate access to the information, and you don't need to download or to send anything by UtraLink. There is also better visibility. You can check the status online, and you have 24/7 real-time access. Better usability, because you will be able to log in not only using your PC, but also using your tablet or your phone. And as I mentioned earlier, it's a more secured platform because the documents are uploaded in SharePoint and they are not circulated by email or UtraLink. There is one more aspect we want to highlight, and this is it's a channel of communication that we have within this platform, which is called IRIS Stakeholder Forums. So we use these for news from EMA, and the beauty of this forum is that you can access it publicly. You don't need to have a username or a password to read the threads. You only need credentials to write and reply, so to log in. It's already up and running, and this is an additional channel on top of the EMA service desk and Ask EMA. So I would encourage all of you to go to the link that I showed earlier and have a look at the forums, because you might already find news or instructions that might be helpful. I'm gonna go now a bit into the high-level business process. It is really high level, but I thought it was important to show to you how the information flows in IRIS. In most of the procedures that we have already onboarded, I mentioned, for example, scientific advice, the flow starts normally with industry, so with yourselves creating an online application, and you do so via the industry portal. Once a submission is in the system, a case is created, and that case is managed through the CRM interface, so that EMA can look at the application, validate it if necessary, and process it. And then what we do is we expose the necessary information to the network, so to NCAs, who might need to put together an assessment report, or in the case of inspections, an inspection report, and we do this via the network portal. The difference between the standard flow of information and the inspections flow is that, as you know, inspections are not triggered by industry. Inspections are triggered by regulators. So you can see that here we have inverted the order of the first two boxes, and the flow starts with EMA creating an inspection case in CRM and then pushing it to process the inspection. So what happens is that once we have created the case and the relevant committee, CHMP or CVMP, has adopted the inspection, then submissions are automatically created for each of the MAH for which there is a product in the scope of the inspection. So you don't need to submit or to create a submission. You will be notified that a submission has been created for you, and you will be able to access the details of such submission via the industry portal. This will also allow you to enter data and submit documents. And the last part is the same as before. So we expose the necessary information to the network, and we do it via the network portal. In the case of inspections, the inspectors will be uploading the inspection reports through SharePoint. So when we talk about inspections in IRIS and the onboarding of inspections in IRIS, which kinds of inspections are we really talking about? And I think it's important that we repeat what is really the scope of this project. We are talking about 3 types of inspections, and these are GMP, GCP, and pharmacovigilance inspections. You may know that at EMA we manage also other types of inspections, and these are, for example, PMF, plasma master file, and GLP inspections, so good laboratory practice. but they are outside of this project and therefore they are not onboarded in IRIS. So if any of your companies is involved in any of these inspections, just bear in mind that we will continue with the current practice outside IRIS. They may be considered later in the IRIS roadmap, but for the time being, they are excluded. And with this, I'm going to hand over to my colleague Carlo De Vittoria, who's going to explain a bit more about the registration in IRIS and the access management. Carlo, I hope you can hear me. We need to unmute you, so give us a second, and I think you will be able to speak. So, Carlo, over to you.
Thank you. So, as Esther said, my name is Carlo De Vittoria. I work in the Information Security Office. My role is mainly to look after the identity and access management part. So this is the high-level flow that you will need to follow in IRIS, in the EMA account management platform, the first time you register. So if you never accessed IRIS before, you need to go through the full process. Instead, if you already had access to IRIS for other procedures, or if other colleagues had access to IRIS for other procedures, some of the steps that we are describing here can be skipped. One super important prerequisite, of course, is that your organization exists in our master data management system for organization, that is OMS. OMS stands for Organization Management System and is part of the SPOR system. You can check if an organization is registered directly in the SPOR portal. Is available at spor.ema.europa.eu. But you can look for an organization in other places like IRIS itself, and also in the EMA account management platform. So when you need to request access as a first user of IRIS, what you will need to do is to look for the IRIS user admin role for the industry, and then you will need to attach an affiliation template that is signed by the company on which you access data in behalf to. We will see later. So if a third party needs to access in behalf of a company, the company needs to delegate access to this third party via this affiliation letter. After you submit the request, there is a further screen where you can select the organization. And then this request as a first user administrator is always approved by the EMA. So we will verify the affiliation template letter. We will verify other information about the user requesting, the user that is signing the form, and then we will eventually approve or deny the request. So this is only for the first user administrator. All the other user administrators will be approved by the appointed user administrators. So we always advise to have more than one so that the process will be resilient and we don't need to be involved. When the user administrator is appointed, then all other roles in IRIS can be requested. If a user is trying to request a manager or a contributor in IRIS without a user administrator appointed, the system will automatically reject the request. So the first important thing is always to check that the user administrator is appointed for the organization. When the user administrator is appointed, then all other users can request access, and this access is approved by the pool of user administrators that are appointed for that specific organization. So with this model, we completely delegate to the organization to define the governance model that they want to have. So who can access the system when they want to revoke access, and the user administrator has the possibility of doing all this function in the EMA account management system. So some tips for the first user administrator. As I said, this is something that we as EMA verify. So it's really important that it's coming with a work email, a business email. and it will really facilitate the approval if the email is coming from the same organization for which the user is requesting access in VR. For the first user administrator, we will tend to refuse all requests coming from private addresses like Gmail, Yahoo, and similars. As I said, we recommend to have more than one user administrator, because this will allow you to gather with any kind of problem. If a user administrator is on holiday or is leaving the company, the other user administrator can take over the role and can revoke access. So it's important that these concepts are clear. And as I said before, we also have set third-party providers as consultants to request access in behalf of your organization. They can do it with their own business email. It's important that you recognize that they are the right consultants. And even if they want to be the user administrator, it's important that they provide the right affiliation letter with the right information, so we can verify that access is granted to the right person. All the process with a step-by-step guide is documented in the homepage of the EMA account management system. You can find it at register.ema.europa.eu, and the homepage will show you the different functionality of the system, and specifically how to request access in the link that we have put in the presentation. These are the different roles that are available for IRIS in general, and that will be applicable also for the inspection procedures. As we said, the user administrator role is a role that doesn't give access to IRIS platform itself, but it grants access only in the EMA account management system. So this user will not be able to access the IRIS platform unless he requests also a manager or a contributor role. Then we have the IRIS Industry Manager, that is one of the main roles in the platform. This role has several functionalities, so it will be able to create, delete, and delete applications. It will be able to edit and view only the applications created by the manager or for which he is appointed. And we also able to appoint other users like contributors to participate to the specific procedure. And finally, the manager is the one that is also responsible for submitting the application. So clicking the final validation of the submission. The IRIS industry contributor is a limited access, can only edit and view the specific applications where he's invited to contribute, but it cannot submit the application itself. So it's a limited role with limited functionalities.
Thank you very much, Carlo. Yes, we can read them for you, or how would you like to do it?
Let's see if we can answer them straight away.
Okay.
The first thing is, how may I change my username? This is unfortunately not possible. So we have in our future roadmap to rely only on emails, but right now the username is used, and it's not possible to change the username because it creates many dependencies also on other applications. So this is not possible at this point in time. The only option that you have is to register a new user, but we discourage this because this will again create duplicates in the platform.
Carlo, we can, if you want, if it's easier for you, we can read the questions out loud because we have them in front of us. So we can read them and then we can answer them together.
Yeah, okay, as you prefer, yes.
So the next question is the following.
As an MAH, would we receive inspection requests for all organizations registered under our account?
So I would say, Esther, this is more an IRIS-related question, more than access.
Indeed. So I'm not sure what is meant by all the organizations under our account. Do you mean all the sites with whom the MAH works? Because the idea is that as an MAH, you are notified of the inspections related to the products for which you hold a marketing authorization. I don't know if this addresses the question, but what we can do is we can elaborate a bit further if the person who raised this question would like to to add further details. And when we talk about the products for which you hold a marketing authorization, of course, I'm always talking about centrally authorized products. So IRIS is limited to manage inspections for CAPs. We are not talking here about inspections for nationally authorized products. Next question.
If an organization already has an admin user for IRIS scientific advice, is this person automatically admin for IRIS inspections, or is there an additional step needed?
Under the same umbrella, the IRIS administrator can approve requests to access the platform for all the procedures. If it's a scientific advice or if it's an inspection, is everything under the same umbrella.
Can a user admin approve another person as a user admin? This will help in case of people being out of office or leaving an organization.
Exactly, yes, and this is what we advise to do, to have more than one user administrator. As I said before, only the first one is appointed by the EMA. All the other ones are approved by the user administrators available for that organization. So we strongly encourage to have more than one.
The next question is, do you need an IRIS manager role for multiple entities? And so do you need to apply for each entity separately?
Yes, it depends on the regulatory entitlements where they are sitting. So in case there are multiple organizations in different countries, you will need to apply differently for each organization.
All right. We can see there are other questions, but I think they are not so much linked to access management. Maybe they are more related to the way IRIS will be working. So I would propose that we answer them at the end. If there is anything else related to access management, please feel free to write it in the chat. And as I said, we will compile all the questions and we can liaise with Carlo to come back to you and give you an answer. So, Carlo, thank you very much for your presentation and for explaining the different access roles in IRIS. Thank you. So we're going to move on now to the next section of the presentation, which talks about the planned go-lives. And you can see on the screen that we have a timeline that goes back to April, but I have to say that actually this project started much earlier. We already started in 2020, a bit before the summer, gathering requirements and setting up the project team and setting up the colleagues who will be contributing. And development started already towards the end of last year. And then at the beginning of this year, we started working on our change management strategy, our change management plan. You might know that we established an industry volunteer group, and also we did the same for NCAs, for inspectors. So this was very helpful for us, and I want to thank publicly the colleagues who were put forward, because their input was very useful for us to focus on what we needed to clarify further and to explain areas where perhaps there was a bit of lack of clarity. And these change champions groups, as I said, we had them for industry volunteers and also for inspectors. We kicked them off in May and June. So you see that in May we had the kickoff webinar with the inspectors, change champions. And then a bit later in June, towards the end of June, beginning of July, we had the kickoff webinar with industry change champions. Since then, we've been quite busy every month because we wanted to have at least one monthly meeting with each of these groups to be able to show how we were developing the system so that they could start getting familiar with it, ask their questions, and also raise concerns that they may had at the time so that we could address them before going live. And then we are at the point where, if you can see in the screen, in September, where we are running a series of training sessions. This week, I have to say, has been very hectic because we've been running a number of sessions not only for internal stakeholders at EMA, but also for external stakeholders. So yesterday we had a session with GMP and GCP inspectors, and today we are having this industry training focusing very much on GMP and GCP. We are also planning subsequent training sessions. There is one planned for next week that is addressing committee members. And then once we go live with, or ahead of the go live for pharmacovigilance, we will have a dedicated session with inspectors on pharmacovigilance inspections. And also you will hear from us because we will organize a training session for industry users focused on pharmacovigilance inspections. So this is related to training. But of course, together with all these training sessions, we also have a lot of communication. So we are working now on preparing the communications for the go lives. Also, we will have some features in the IRIS newsletters. As I said, the IRIS forums. We will publish the relevant announcements on the EMA website so that you can keep up to date with when we're going live. And speaking of going live, I have to say that initially the planned go live for GMP was next Monday, 13th. This was our aim, but very recently we've learned that we will need to postpone it for a few days. So most likely we will go live the week after. So still in September, but a few days afterwards. For GCP, we have a tentative go live of end of this month. But again, depending on how things are progressing, we might delay it slightly for a few days and go live in October. For pharmacovigilance, I cannot give you a specific month because development is still in a very early stage, but as soon as we have more information and we are a bit more advanced, we will let you know when pharmacovigilance inspections will be onboarded. And I would like now to focus on GMP and give you an overview of the high-level business process that we will be following in IRIS for GMP inspections. You will see that even though it says GMP workflow, when we talk about GCP, it's not so different. But we thought it's better to go through it step by step and then repeat it for GCP, explaining what the differences are. So the workflow, as I mentioned earlier, will start with the creation of a case, with a GMP inspection case. And as I said earlier, this will be triggered by EMA. So industry users do not need to trigger anything, don't need to create any submission. We at EMA, we will create the inspection request and we will take all the necessary steps to make sure that that inspection is adopted by the relevant committee. So CHMP in the case of human medicinal products and CVMP for veterinary products. Once the inspection is adopted by the committee, you will receive a notification, and we will talk a bit more about this notification. This will prompt you to know that something has been requested for a product for which your company holds the marketing authorization. And this will also provide you with the ability to go through the portal once you are an IRIS registered user, go through the industry portal and view all the details related to that inspection. At this point, you also have the possibility to enter the PO number, so the purchase order number, via the portal. So in the current process, we used to request that you would provide this to us, and normally this will be done via email, but now you don't need to send us an email. There is a specific field in IRIS which allows you to enter the PO number. And I want to highlight the importance of providing this information to EMA, because this is very much linked to the financial procedure. So it speeds up the process and also helps us to make sure we have the correct information for that particular inspection. What will happen after the inspection is adopted is that we will start all the preparatory work to actually conduct the inspection. And as you probably know, one of the main responsibilities that we have here at this point is to confirm that any inspector who is participating in an EMA inspection does not have a conflict of interest. So we have a policy and a procedure at EMA where we check for each inspector involved in an inspection, regardless of the type of inspection, we check their declaration of interest and we confirm that indeed it is in accordance with our policy and that the inspectors are approved to participate. Once that is done, the inspection will be scheduled. We will be notified by the inspectors when the inspection is taking place. You know what happens next. The inspection is actually happening. There is the interaction between the inspection team and the inspectee. At the end of the inspection, there is this closing meeting, and after that, the inspection team would go back to put together a draft inspection report that is provided to the inspectee so that the inspectee has the chance to read it and address any deficiencies that have been identified. Once the responses from the inspectee have been received by the inspection team, they will finalize the inspection report and provide it to EMA. Once EMA receives that inspection report, we will put in IRIS, when we have received the report, whether the report is valid, whether there is a clear conclusion of the report. So, for example, if it's a GMP inspection, is the site GMP compliant or not? Any additional information that the inspectors want to flag to us, and also when is the next inspection, so the reinspection date. Once all that is clear, then we will proceed with the finalization of the case, and you will be notified that the case has been closed. One thing I want to highlight here is the note that you have on the right-hand side at the bottom, where it says that the receipt of the inspection report at EMA, so when we receive the report from the inspectors, this triggers the financial workflow. And I want to highlight this because this is new compared to the current process. In the current process, the invoice to the applicant was sent on the first day of the inspection. This is not going to happen anymore. With IRIS, the invoice to the MAH or to the applicant will be sent at the time we receive the inspection report. So if you wonder, oh, there are some inspections that are ongoing, they are managing the old system, I'm receiving the invoice at the time of the start of the inspection, but this is not in line with IRIS, you know why. With IRIS, we are changing this practice and you will receive the invoice later in the process. And now I'm going to hand over to my colleague Miguel, who's going to take you through the GCP business process. So Miguel, over to you.
Hello, everybody, and thank you very much for attending this training. As Esther already presented, my name is Miguel Rodriguez, and I'm the GCP subject matter expert. And I would like to introduce you to the business process for GCP, even if there is not so much difference compared to the GMP. But so I will not repeat myself. I will not repeat what Esther has already said. I will just highlight what are the differences between GMP and GCP. So as you can see, the steps are more or less the same. So for GCP, we will start creating the GCP case once it has identified a need for a GCP inspection, routine or trigger. And we will be working on deciding on the clinical trial and the sites to be inspected. And obviously that will be done in-house. Then once the request has been adopted by the CGMP, automatically you will get a notification. And as I understand, and Esther will clarify, this notification will go to the contact person for the application or MAH. In there, similar to the announcement letters that we send at the moment, that we will not send them in the future, you just get a notification. We will ask you to provide some documentations to EMEA and to the inspectors. The documentation and data to EMEA, it will go through IRIS. So those are the PO number and some other documentation like the acceptance of the inspection and the permission for the MAH to receive the inspection report from the sponsor if applicable. Those ones, they will go to EMA through IRIS. And the rest, the ones for the inspectors, they will need to go to the inspectors. And you can discuss with them how to receive it. At the moment, we will follow the procedure that we follow at the moment. That's by CD or CD-ROM or USB, as you have been doing. Normally, we check the DOIs of the inspectors before we adopt an inspection, but just in case there has been a later addition, I have included this step later on. One thing that we need to explain is that you will get a notification every time that there is a change to the request for the inspection. So if we add a new site for any reasons, if we remove one site, if we add a clinical trial, you will get a notification. Or if we change the date of the deadline for the integrated inspection report. For GMP, the process for the inspection will go on, and the inspectors will be responsible to contact the applicant and to ask for contacts for the inspectees and any coordinator for the inspection, and that will take place outside IRIS unless it's decided by the inspectors to do it through IRIS, but in principle it will be outside. And once everything has been done, all the communication with the inspectees, the responses to the inspection report, and the finalization of the integrated inspection report, the inspectors are responsible to upload that document to the IRIS platform. As EMEA coordinators, we will check that the documentation is complete, and as it was for GMP, we will issue the invoice and the payment for the inspectors once everything has been validated, and you will get a notification that the process has finalized. As I said at the beginning, if we have the permission to share the integrated inspection report with the applicant, we will do so at this point. And I think I just highlighted the differences. Everything else will be very similar to GMP.
Thanks very much, Miguel. Thank you for flagging those differences. So now, colleagues, I would like to move on to talk a bit more in detail about notifications. So we've mentioned throughout the presentation what is changing, but I want to repeat once again in practice what modifications you will see in the process. So you might be familiar with the way we communicate the announcement of inspections at the moment. And in the ASIS process, what EMA does is we create two sets of inspection correspondence at the beginning of the process. So one set of inspections goes to the applicant, and the other set of inspections of correspondence go to the MAH. What happens is that every time that something changes, we need to make changes to the letters and resend them. With IRIS, this will change because we will move away from letters. There will not be any letters because all the information will be up to date in the portal, and you will access it through the industry portal. Essentially, what will happen is that we will have no more inspection correspondence being sent by Udralink. You will receive an email that prompts you to log into the IRIS industry portal, and in the portal you can see all the information related to the inspection. What you can see on this slide is the types of notifications that you will receive. And when I say that you will receive, I always mean the contact point for the applicant or MAH for that particular product. So at EMA, as you know, for each product, we have a person who is nominated formally to communicate on behalf of the applicant or MAH, and this is the contact that will receive the notification. So you will need to make sure that those contacts are actually have access to IRIS, because otherwise they will receive an email, but when they try to log into IRIS, they will not be able to access. So very important that you liaise with your colleagues who are at the moment nominated as contact points for centrally authorized IRIS products, and that you start requesting access for IRIS to these colleagues. These colleagues will receive a notification that an inspection has been requested by EMA for their products, and you, as I said, you would be asked to log into the system to view the details. Then, if for whatever reason we cancel the inspection, or the inspection is cancelled, and this happens after the committee has adopted the inspection, then of course the industry will be notified. So again, the applicant or MAH will be notified, and this cancellation of course will also result in a cancellation fee, so an invoice will be sent accordingly. Applicants and MAHs will also be prompted in case there are modifications of the inspection request after the committee adoption. So, for example, sometimes the inspection team changes, so the inspectorates involved are different. Sometimes the reporting deadline is different. And of course, because these details are important, we will let you know. Last but not least, we will notify you at the end of the process when the inspection report has been finalized and validated, and you will be able to see the inspection outcome in the industry portal. So just to give you a flavor, a mock example of how an application would look like, this is just a generic text. So when we adopt an inspection by the committee, you will receive a message, very short, that says, "Dear applicant or contact point of the MAH, we would like to inform you that an inspection with reference number XYZ has been adopted by the relevant committee, and the details can be accessed via the IRIS industry portal. Please let us know if you have any questions or comments." So if when you receive this notification, you already have access to IRIS, you see that you have a comment or a question about that particular inspection, the way you would communicate with EMA is via the messaging system that exists within IRIS. It's like an Outlook functionality, and you can type your messages, send your questions, and it will be received by whoever is the inspection coordinator at the EMA. Another very important point that I cannot stress enough is that because we are not going to send announcement letters via UDRA link anymore, the date of the notification that you have on the screen, so when we notify you that an inspection has been adopted by the relevant committee, that will serve as the official notification date. So don't expect a PDF document. That date when the notification is sent will be the cutoff point, meaning that if an inspection is cancelled after that date, then a cancellation fee will apply. And I want you to remember this. It's also included in the guidance that we will be publishing. Of course, we have developed some guidance, not only for inspectors, but also for industry users who are involved in EMA inspections. And we will make sure that this is highlighted there, because when you log in through the portal and you provide the relevant documentation or PO number, you will be required to tick the box that confirms that you have read and understood that information, that guidance. And we are now moving towards the end of the presentation. Before we do the video and we show you the actual IRIS industry portal live, I just want to talk to you about the next steps. We are following, as I mentioned earlier, a phased approach for the go live. So GMP inspections are going to go live in September, as I said, originally planned for next Monday, the 13th, but now we have received a confirmation that this will happen a few days later. For GCP, it will happen between the end of September and beginning of October. And for pharmacovigilance inspections, we will let you know once this is confirmed. As I mentioned also, we've been running training sessions on the use of IRIS, particularly focusing on inspections. We've been training our colleagues who will be managing inspections at EMA. We have had a session with inspectors. We are going to have, as I said, a training for committee members next week. And we are also doing this session on GMP and GCP for industry, and also the one we will have later on in the year for pharmacovigilance. One important point, I think you were asking in the chat, this presentation is being recorded, this training session is recorded, and we will make the recording available to you. And you can, of course, provide this recording to your colleagues in your companies who perhaps were not able to join us today. And last but not least, I just want to reassure you that, of course, this is a new process, and it means that we all need to go through this learning curve and to ease the path and support you. We have a couple of channels through which you can reach out to us. One of them is via the IT service desk in case you have technical issues, and this could be, for example, that you need to reset your password, or you are struggling to access IDs and maybe there is a problem with your user account. So those things you can report via the IT service desk. If you have a more business-related question, I'm not sure what the process is about, I'm not sure why I have been charged this particular fee, then you can reach out to us via the iris@ema.europa.eu mailbox. As I said, I'm going to take you now through a video, and I will post the video to walk you through the steps that you will need to follow once you have access to the IRIS industry portal. So this is what you can see right now on the screen is the landing page of IRIS. This is the page you will reach if you follow the link that I included in the presentation that, as I said, we will share with you. Just note that what I'm presenting right now is UAT environment. So there may be some things that are not quite the way you will see them in production, but we are using these for illustrative purposes. So once you get to this landing page, you see here with this red square, you have rectangle, I should say, you have this sign in button, and this will allow you to enter your credentials. So once you enter your credentials, what you can do is you can go at the top of the screen. You have a section that is called submissions, and you can view your draft submissions. So as I said, we as EMA, we will create the case, and the case will lead to the generation of a submission for each MAH, so for each product, I should say, for each product that is included in the scope of an inspection. And then what will happen is that, let me just, here. So you go to My Draft Submissions, and then you can see under Draft Submissions, you have a table. The way the table is structured is you have the first column that is a parent submission ID. It's just the reference number that the system generates, and it's exactly the same as the submission ID. There are no differences, so you don't need to worry about. But it's important that you quote this number if necessary when you're communicating with us. This is a number that will be present throughout the system, and it just identifies that particular inspection. Then you will see the submission type, meaning, okay, what type of inspection is this? Is it a GMP inspection, a GCP, pharmacovigilance inspection? Then you see the next column is called sponsor. Actually, this would most likely be replaced to MAH applicant sponsor, because we have this convention for various procedures at the EMA. Then you have a subject and modified on. So when you are on the screen, you have on the right-hand side, you have an arrow that allows you to view or manage contributors, also view or manage managers, and also manage submission contacts. So let's start with the view manage contributors. So as you can see, once you click on View and Manage Contributors, you get to this screen where you have a button that allows you to add. So this is the role that Carlo was referring earlier, who is a person who can view a particular submission. And you can add this name by clicking on this blue button here. And once you add that person, the person contact details will appear in the subsequent table. If we go back to the previous screen, the next option that you have under View and Manage Contributors is called View and Manage Managers. And you have this highlighted with a red rectangle at the moment. The way you view and manage managers and the way you manage submission contacts is exactly the same. So in the next screen, I'm going to show you how you view and manage managers, but this is applicable also to the submission contacts. So you can see this screen looks like the one I showed you before for the contributors. You click on Add, and you can select the name of the person. It appears together with its email address underneath, and then you click on Done, and that manager is added. As I said, the managed submission contact, the submission contacts are added in the same way, and then you just save and return. So the next option that you have, actually, that appears at the top of this drop-down menu, it's Edit Draft. It might be that you're wondering, okay, what is exactly what we can edit? Because of course, you cannot edit the type of inspection, you cannot edit the products that are in scope of inspection, you cannot edit, in the case of GMP inspections, the manufacturing activities, because this is all determined by EMA in collaboration with the NCAs. But what you can do when you click on Edit Draft is you can add have a look at the inspection overview, and you can view the details of the inspection. So here on this screen, under the inspection overview, what you can see is the type of inspection. In this case, it's the post-authorization inspection. It gives you what's the name of the lead inspectorate. It gives you the name of the supporting inspectorate together with the addresses of the NCAs. It will give you the reporting deadline. So even if here you see it's blank, you will be able to see it in production. And then if you scroll down, you will see the inspection contacts. So the difference between the contacts that you have at the top and the contacts that you have underneath is that at the top you have the inspectorate contact. So at EMA for GMP inspections, we normally liaise with one contact point per NCA. But then underneath, what you see is the names of the actual inspectors who will be involved in the inspection. You can see whether their role is a lead inspector or just inspector, meaning supporting. And then you can also see their email addresses and the NCA they belong to. When you click on the button Return, the screen will go back to the submission form screen, and then you can click on Inspection Details. And under Inspection Details, what you can see is the actual products. So here, as I said, you will only be able to see the products in scope of the inspection for which you hold the marketing authorization. And you will see not only the product name, but also the product number at EMA, whether it's human or vet, that's the domain, the active substance, the number of fees that apply, and also you are able to see the pharmaceutical form and strength, of course, and most importantly, the manufacturing operations. So the products, together with the manufacturing operations, will determine the scope of the inspection. Now, one more thing that you can do while you are on this screen is you can see here on the right-hand side, you have a column that refers to the purchase order number. And you have a little arrow that when you click on it, you have the possibility to edit. And here is the field where you will enter your purchase order number for this particular product. You also have the possibility to enter some comments, but I would suggest, I would encourage you that if you have questions or really critical issues that you want to discuss with EMA, that instead of using this box that you have underneath that allows you to enter free text field, if you really need a response from EMA, that you use the messaging functionality in IRIS to communicate with the relevant inspection coordinator, meaning that when you receive a notification from IRIS, you can respond to that notification, and very important, don't change the subject. So as you can see, when you click on edit, there is a field that gets displayed, purchase order number, this is where you would enter it, and then you click on submit. If you go back to the previous screen, here, document from applicant, here is where, when you click on it, you have the possibility to upload the documents that you would need, for example, in the context of a GCP inspection. All the documents that are required for a GCP inspection are detailed in the guidance that we are publishing and that you are required to read and confirm that you have read and understood. So when you click on document from applicant, as you can see, it's very easy to add any files. You just click on the relevant button that is highlighted here, and then you simply upload all the documentation. The system will ask you to choose the files. You select them as you would do with any other system, and you just click on Add Files. Once that is done, if I go back to this screen, you will see that there is a section that says Documents from EMA and Declare and Submit the changes. In Documents from EMA, if you click on that, you will find any documents that EMA would like to share with you as the MAH, and we will upload them in SharePoint, and they will be available to you for viewing through that link. The last step would be to declare and submit the changes, meaning the documentation that you have uploaded and the PO number that you have entered. And then when you click on this last hyperlink, the following screen will appear. So, very important that you read this declaration, because once you have clicked on Submit Application, then the form will be locked, meaning that you will not be able to change it. You are also required, as I said, to click on this tick box to confirm that you have read and understood the guidance for applicants and MAHs involved in EMA inspections, and that you, as the person authorized to sign, that the content is okay to be submitted. You can see that the guidance is in blue because this is a hyperlink. So before you actually click, you have very easily access to the guidance. Once you have read it, just click on Submit Application, and then the submission will be locked. The system will ask you one more time in case you realize that actually you've forgotten something. So you have a double check here. You can, at this point, review the application if you click on the relevant button, or you can say, no, I'm sure this is fine. I'm comfortable with my details, my data, and I just want to submit. And once you click on the submit button, you will receive this message indicating that the application has been submitted successfully. And with this, we have concluded the walkthrough the video of the industry portal. We used an example of a GMP inspection, but actually it's the same process for GCP inspections. The difference is one that Miguel highlighted earlier, the fact that for GCP inspections, you will be required to upload a number of documents, but I showed you how to do that. And there might be other fields, especially when you check the inspection details, that of course will have a different type of information if it's a GCP inspection. But the mechanics is the same, and you will follow the same process. So what I would suggest now, because it's already 11:22, is that we spent the last minutes of this training session today going through the questions we have received in the chat. We saw that there are some questions related to access management, but because Carlo is not with us right now, what I would propose is that anything related to access management, we review the questions offline after this training. We liaise with him and we come back to you to provide you the answers in writing. And in these few minutes that we have left, we focus on the actual questions related to the business process, and we answer as many as we can. So Dunia, over to you.
Thank you, Esther. So the first question is, can alerts be set in order not to check the platform every day?
So the notifications will be set up from our side to prompt you when an inspection has been adopted, for example. So you don't need to check the platform every day. You will receive the notification when an inspection is adopted. And you will also receive notifications, as I mentioned earlier, when an inspection is cancelled, when an inspection is modified, or at the end of the process when the inspection is concluded. So there are milestones at which you will receive notifications, and these will be set up by EMA.
For the next question, I will give floor to Miguel. Will there be a link with CTIS and IRIS?
Okay, thank you for the question. At the moment, it was outside of the scope of this project, but anyway, we used an agile system in order to create IRIS for inspection. So it may be considered at the future if we think is relevant and useful.
Thank you, Miguel. Esther, the next question is for you. Does a company that is only a manufacturer, not an MAH, need an IRIS account?
Very good question. The answer is no, because EMA only communicates for GMP and GCP inspections, only communicates with the MAH and the applicant. So if you belong to a company that is just a manufacturer and therefore a potential inspectee, you don't need to have access to IRIS, because the details of the inspection will be communicated to the MAH, and it will be the responsibility of the MAH to liaise with you as an inspectee, and also the inspectors will contact you directly as an inspectee, but they will do so outside.
The next question, will there be a transition period after the go live, i.e. GMP GCP inspections are handled in parallel via IRIS and the established process?
Very good question as well. Indeed, we're going to have a transition period that we envisage it will last for about 12 months. The reason is because for GMP inspections, as you know, often the reporting deadline can be up to a year after the time when it's requested. So any inspections that have been already requested in the old system and that follow the as-is process will be finalized according to the current practice. After go live, any inspections that are in IRIS will continue in IRIS and be finalized in IRIS. So absolutely, we can expect up to a year of transition period where the two systems will run in parallel. One important point I want to mention here is that we are not migrating any data from the old system to the new one. So in IRIS, you will only see the inspections that are triggered from the moment we go live onwards.
Thank you. Next question, is the invoice received through IRIS?
The invoice, you will receive it as you normally do. So the process that manages IRIS for inspections is connected to the SAP interface, the finance interface, and you will continue to receive the invoice in the way you are receiving it now.
I will ask Miguel for the next two questions. Can we understand that GCP inspections for veterinary applications are currently out of scope?
No, they are in scope.
Thank you. Can you confirm that IRIS will not be used to send documents requested for GCP inspections? Will we still have to send them by courier on flash drives?
Okay. So as I said before, for EMEA documentation, any documentation that at the moment we ask for EMEA, it will be done through IRIS. For the part of the inspectors, you need to liaise with the reporting inspectorate and agree. This is something that we are going to discuss in the GCP Inspector Working Group and try to get an agreement, but I have the feeling that because of the large quantity of documentation and the weight of those documentation, unfortunately, we will need to continue with the current system.
Thank you. Esther, will the EMA communicate with the GMP side directly as well as the MAH?
This is a bit linked to the question that was posted earlier. So no, EMA in the current process, EMA never communicates with the site that is going to be inspected. We manage all the communication through the MAH or the applicant, and this practice will not change with the launch of IRIS. So in the future, we will continue all our communication with the MAH and the applicant. It's just that instead of doing it via UDRA or email, we will do it via IRIS. And the ones who will be contacting directly the manufacturer are the inspection team, the inspectorates, as they currently do.
And for the last question we will address in this training, I decided to choose one which is on confidentiality, which I think it's really important. So inspection reports are related to one manufacturing site. If several MAHs are impacted by a site inspection, is the process to handle confidentiality of a finding specific to a product documented to make sure that the inspection report that will be visible by several MAHs will not compromise any confidentiality issues?
Absolutely, Dunia. This is a key question, and I want to make sure everyone understands the process. At the moment, EMA does not share any inspection report with any MAH for GMP inspections. So as the question correctly said, an inspection, a GMP inspection, might cover several centrally authorized products that are manufactured at one particular facility. However, neither EMA is currently sharing the inspection report with any MAH, nor will it do it in the future. So even after we launch IRIS, the inspection report that is provided from the inspectors to EMA will remain visible only to EMA and to the NCAs. It will not be shared with any MAH. So it is up to the inspectee. If the inspectee has an arrangement with the MAHs and they wish to share it with them, then they should have the mechanisms in place to protect confidentiality. But from the EMA side, please rest assured that we ensure confidentiality by not sharing the inspection report with any MAH. I can see that there are a few more questions in the chat, but because we have now reached the end of this training session, I would propose that we also look at these questions afterwards and we reply to you in writing. So don't worry if you didn't manage to get your question answered. You will get an answer in writing. I will repeat again, we will share the broadcast. We will share the recording, I should say, with all of you, and we will also share the slides so that you can go over them again. So with this, I just would like to thank you again for your attention, for all your very useful questions. And I want to thank my colleagues, Delia, Carlo, Dunia, and Miguel for all their support. I hope you find this training session useful, and I wish you a good day and a good weekend. Thank you.